This week we're talking about common hand and wrist injuries with the ice and snow on the ground and soon to be on the ground in a big way, it sounds like. It's a big problem this time of year. Dr. Jarrell Manon-Matos is a new attending physician with Kleinert Kutz Hand Care Center. He's joining us now with more on some of those common issues that we face in the wintertime. Do you see a lot of hand injuries this time of year?
Yeah, well, the wintertime can be a very difficult time for the hand and wrist if you're not careful, and patients who are pretty active, especially when you're out in the snow and you're shoveling, or if you slip on the ice. We see a lot of wrist fractures, even up to 2 or 3 per day.
Can a lot of people get a fracture and not realize it's fractured for a little while?
Oh yeah, I think especially if you're very active and you're used to being active, then you can break your wrist. You might have some soreness, and then 1 to 2 days later it really hurts, or you just can't use your hand as you're used to.
So what are the signs that you need to get to the doctor?
Well, really, if you see a lot of swelling, or if you feel weak or pain with grip or using the tools that you commonly use, then you should probably get to the doctor within a week. Yeah.
And if you don't get there quick enough, what could happen?
Then you'll feel what can happen, which means that you'll just continue to be in pain, and you just won't be able to use your hand as you're used to.
Now, what about cuts, slicing and dicing out there?
Yeah, you see a lot of cuts and lacerations as well. Patients might be, again, out active, trying to do what they normally do in their workshops, but now it's 20 degrees or 30 degrees, so your skin isn't as pliable as it normally is, and you do get a lot of cuts. Or for those people who are cooking dinners for their families and they're spending a lot more time indoors, you'll see a lot of knife injuries from
making
trying
those
to
hearty
cut the
meals,
turkey or make a casserole, and we have seen a number of tendon injuries from that as well. So I think really just look for the skin injury, and if you really can't bend your fingers, don't wait on it. Don't think it's going to get better. You really should see the doctor soon.
Well, we actually had a photographer here, a friend that maybe a month or so ago cut his hand pretty bad and waited to get to the doctor. And by the time he got there, they said he'd waited too long to get stitches. So that can happen?
Oh, yeah, we see that quite a bit. We'll see people who say they might be preparing a meal in their kitchen and might think they have a little cut, and really they cut a tendon and they can't bend their finger, and they overlook it, and they come to the office, 3 to 4 weeks later, and by that time it can be a real challenge to fix it, and the surgery can be a little bit more complicated.
Well, we have a caller has a question for you. Debbie from Louisville. Go ahead with your question.
Yes, I think I jammed my ring finger on my right hand, and it's been about 3 weeks, and it's still really sore in the knuckle, and I didn't know if I should maybe have that checked out, if it could be fractured or something in there.
Does the tip bend down?
Yeah, I can bend it, but there's a knot in the large knuckle. There's like a knot there on the side of my...
Well, sometimes you do see a common injury called a mallet finger, which happens. It's when you jam your finger. You see these a lot in athletes playing basketball, or they fall, or people just really just active and living. And what happens is that you can break the little bone at the tip bends down, and you also may have a tendon injury with that. So a break and a tendon injury, one or the other, sometimes combined, and normally we can just treat that really quickly with a splint for about 6 weeks, but sometimes you do need surgery for that too.
Okay. We also have Melissa from Crestwood that has a question for you as well, that has a baby I hear in the background. Go ahead, Melissa.
Hello. I've got a question. I had a baby a couple of months ago, and probably a week after I had the baby, my fingers started to get numb, my right ring finger, the tip of my finger, and it started to work its way to the other tips of my fingers. And I was told from the OB that it could possibly be, I'm trying to think of...
Well, numbness and tingling can be really common with nerve compression problems, and oftentimes we have these for a lot longer than you think, and then you have some sort of stressful event, whether it's an injury or pregnancy, along with all the hormonal changes, and that can become more manifested then. And so that can really be either a carpal tunnel or a compression at the elbow, and we start treating that with splinting early on, and I would encourage you to see your doctor, and you'll find that it'll get better the farther you get away from your pregnancy or delivery, but you should get better. And then in the worst case, we do surgeries for that too, but that's a little more down the line.
All right, Dr. Manon-Matos with Kleinert Kutz, thank you. Some great advice. We appreciate you coming in for us today.
Thank you very much.
All right.
Thank you.
We'll be right back.